Welcome to the hybrid operating theatre at Swiss Ablation. My name is Sascha Salzberg. I'm a heart surgeon, specialised in AFib procedures, and I run Swiss Ablation here in Zurich, Switzerland. Swiss Ablation is a comprehensive arrhythmia care centre. We treat cardiac arrhythmias, irregular heartbeats, and the most common cause of this is atrial fibrillation. Atrial fibrillation is set off by electrical impulses in the pulmonary veins. These are the veins leading to the heart going to the left atrium. And that causes an irregular heartbeat, which then is felt like palpitations, dyspnea, and all other kinds of symptoms. Paroxysmal atrial fibrillation and also persistent atrial fibrillation is treated by catheter ablation. Catheter ablation is a technique by which we create a scar between the pulmonary veins and the left atrium, leading to pulmonary vein isolation. This ablation can be achieved with different energy sources. The catheter is put in the heart through the groin, and the energy sources used are radiofrequency, cryothermia, or pulse field ablation. With this, we create a scar, hence leading to electrical isolation of the pulmonary veins and to stable sinus rhythm. This decreases the progression from paroxysmal AF to persistent AF, to heart failure, and also the progression of dementia. Most importantly, it gets rid of your symptoms. Catheter ablation can be done on an outpatient basis. Same day discharge, meaning you come in the morning, have a procedure, and go home in the evening. This can only be done because we have a large experience in our operators and anesthesia. This procedure has a very good safety profile, and we've been doing this for years. So if anyone, if you or any one of your loved ones suffers from AFib or any cardiac arrhythmias, please get in touch and we will see if we can help you.